Okay, so these are the bones of the skull from the medial view in a mid-sagittal cut. So this one that forms the dome of our skull, the calvaria, is the parietal here, frontal here, occipital here. And then if you see, this is the area where we hold the brain. So this is the base of our skull, and this is subdivided into cavities. So this is the anterior cranial fossa, this is the middle cranial fossa, and this is the posterior cranial fossa. Anterior cranial fossa is mainly made by the frontal bone and the ethmoid, which is this. Middle cranial fossa is made by the sphenoid, which is this. And the posterior cranial fossa, and the temporal, which is here. And then the posterior cranial fossa is majorly made by the occipital bone and part of the temporal. And then, of course, this is the view of part of the bones, the facial bones, which includes the mandible. This is the palatine bone, and here anteriorly you have the maxilla. These two makes the hard palate. And then this is the medial view, so this is the nasal septum, and then we have two types of septum. We have cartilaginous, which is the one that we touch in our face, and then this will be the bony septum. The bony septum is made by the two bones. This one, that it is inferior, this is the vomer, and this will be the perpendicular plate of the ethmoid. Another thing that you can see here in the medial view will be these cavities, which are sinuses. The only ones, well, actually we can see three of them. So this is the frontal sinus. So the frontal sinus is just in this part, and then this is the sphenoid bone. So this is the body of the sphenoid. So here we have the sphenoidal sinus, and then this part, this is the maxilla with the largest sinus. So then what we can see as well, other parts in this medial or mid-sagittal view of the skull, it's some openings like this one. This one is the internal acoustic meatus, which it's basically the continuation of the external acoustic meatus. Both are part of the temporal, okay? And then here on the side of this part that is the foramen magnum, here's the hypoglossal canal. So through the hypoglossal canal, the hypoglossal nerve or cranial nerve number 12 passes through, which is the nerve that allows to move the muscles of our tongue. Now, other parts that you can see here in the medial view will be the alveolar processes of the maxilla and the mandible, which holds the teeth. And then here in the mandible, we can see the coronoid process, the mandibular notch, and the mandibular condyle. And this, which will be the mandibular foramen. So through this mandibular foramen, we have a nerve that is called the inferior alveolar nerve that provides sensation to the lower teeth and also the gums. So if you have a lower teeth pain, this nerve, inferior alveolar nerve, or IIN, brings that information. And this nerve is part of the mandibular branch of the trigeminal nerve, or cranial nerve number 5. And here we have the mylohyoid line, which inserts mylohyoid muscle, and we're supposed to have kind of pointed projections here, the genu processes. And then this will be the body of the mandible view internally. This is the ramus, this is the mandibular angle. And here in the external view, we can still see the mandibular notch, mandibular condyle, coronoid process, mandibular angle, ramus, body, and this nerve, this foramen, which will be called mental foramen. So this mental foramen provides innervation through to the area of the chin and the lower lip. And then in here, if we had the other part, we'll be making the mandibular symphysis and the mental protuberance, which is the chin. So those are the parts of the mandible. And then externally, things that you can see, and before that, this is the inferior nasal concha, which is a separate bone. So in externally, what we can see is this suture, which is the squamous suture between the squama of the temporal bone, which is all this, and the parietal bone. I'm not sure that we can see in the parietal bone the temporal lines, the superior and inferior, but we have them in this area. That's where the temporalis muscle, the muscle of mastication, inserts into, and this is the coronal fossa between the frontal bone and the parietal. And then here we have lambdoid suture between parietal and occipital, so this one. And then the squamous between the squama of the temporal bone and parietal, and this is the mastoid process. So this one is the one that has air cells similar to sinuses but smaller. So these are cavities filled with air, and when someone has complications of otitis media, this bacteria can travel into here and causes inflammation of this area. And you have to have surgical drainage of the pus and the bacteria. So they open this bone. So this is external acoustic meatus. This needle-like projection, this is the styloid process of the temporal bone. Then this is the zygomatic process of the temporal bone. This is the zygomatic bone. This is the temporal process of the zygomatic bone. This part of the maxilla, which is this is the infraorbital foramen. And then here we have the supraorbital margin of the frontal. This is the glabella of the frontal. Here we have lacrimal bone with lacrimal fossa. Our tears goes from the middle part of our eye into the inferior meatus of the nasal cavities to drain. And then all of this forms the orbit, so including bones of the orbit, which is zygomatic, lacrimal, ethmoid here posteriorly, palatine as well, and then maxilla, and then the sphenoid, which is seen through here, and then you have the supraorbital fissure. Here we have the lower fissure, which is part of several bones, so this is the infraorbital fissure, optic canal of the temporal, of the sphenoid there. So all of this makes the orbit, very tiny bones. And this hole below the orbit, part of the maxilla, is the infraorbital foramen, and this is the supraorbital foramen. And then here in the inferior part, which is the petrous part of the temporal, what you can see is this fossa for articulation with the condyle of the mandible to make the only movable joint in our skull, which is the temporal mandibular joint. So it's freely movable, it's a diarthrosis, we will see that later. And then in here, in between the styloid process and the mastoid process, we have the stylomastoid foramen. Cranial nerve number 7, facial, passes through here. So this is a nerve, possibly I say muscle, but it's the cranial nerve number 7, which is the facial nerve. This one innervates the muscles of facial expression. And then in here we have the jugular foramen, through which the jugular vein passes through internal jugular vein. And then in here we have the carotid canal, into which the internal carotid artery passes into the brain to provide blood supply to the brain. And I mean, you can see kind of the part of the sphenoid in here as well. The sphenoid is the keystone bone of our skull because it connects all the other bones of the skull. And then laterally here, what you can see is the greater wing of the sphenoid, which is this. And then in here we have the lesser wings of the sphenoid. And in the sphenoid, the greater wings, we have optic canal, foramen rotundum, foramen ovale, and foramen spinosum, which allows the passage of several nerves and blood vessels. And this is all for this part. Bye-bye.